Hi, everyone. Today I'll be talking about surgical radiology and why it's such an important part of modern medicine. Basically, surgical radiology means using imaging like X-rays, CT scans, or even ultrasound during surgery. Instead of operating blindly, surgeons can actually see the inside of the body in real time, which makes surgeries safer, faster, and more precise. This is one of the biggest reasons why modern surgeries are so different from how they used to be even a few decades ago. My first key point is how much this improves accuracy and safety. In this picture, you see a C-arm machine being used during surgery. It gives live X-ray images while the surgeon works, so they can see fractures, tumors, or even surgical tools right away without needing large cuts. That means fewer mistakes and better outcomes for patients. In fact, C-arm machines are especially common in orthopedic surgeries, like fixing broken bones. Because the surgeon can constantly check placement instead of guessing, this procedure reduces the chances of having to redo a procedure later, which is a big deal for patient safety. Another big benefit is guidance for complex procedures. With CT or MRI scans, surgeons can carefully place screws, implants, or catheters while watching exactly where they're going inside the body. This level of precision really isn't possible without imaging. For example, in the brain or spinal surgeries, being just a few millimeters off could cause major damage, but with real-time imaging, surgeons can plan their movements step by step, which gives patients much better results. It also allows surgeons to attempt procedures that would have been considered too risky in the past. This leads to my second point, faster recovery times. Because these procedures don't need big incisions, patients usually have less pain, fewer complications, and can get back to normal life sooner. And finally, surgical radiology is continuing to grow with technology. Here, you see an illustration of a minimally invasive surgery where tiny instruments are guided by imaging. Now, we even have systems that combine imaging with robotics or artificial intelligence, making surgeries even safer and more efficient. For example, robotic-assisted surgeries often rely on imaging to make ultra-precise movements that a human hand alone couldn't achieve. Looking forward, experts believe that as technology advances, surgeries will become even less invasive and even more personalized for each patient. So, to sum it up, surgical radiology is transforming surgery. It improves safety, helps patients recover faster, and continues to advance new technology as it's developed. It really shows how imaging and surgery work hand in hand to save lives.